The U.S. could surpass 600,000 coronavirus deaths this weekend. The nation is racing to vaccinate Americans and avoid another variant-propelled surge. But daily shots are lagging, with the 7-day moving average stuck at below 900,000 doses. Meanwhile, Johnson & Johnson is facing another major setback. It follows reports of contamination at the Emergent Biosolutions plant earlier this year. Omar Villafranca reports.
Tonight, more troubling news for Johnson & Johnson. The FDA reportedly telling J&J 60 million doses produced at the Emergent Biosolutions factory are possibly contaminated and need to be thrown out. J&J had promised to deliver 100 million doses by the end of May, but as of mid-June, fewer than 22 million have actually shipped. States haven't received anything in a month. Vaccine supply, though, not a problem. Millions of Pfizer and Moderna vaccines are available, but demand is way down, like in Oklahoma.
We were able to get up to about 15,000 vaccines a day, and now we're right around 2,000 a day. So we are so much farther below capacity.
In the race to vaccinate, Oklahoma ranks near the bottom. Just 54% of adults have had at least one dose. Nationwide, it's 64%. Oklahoma now has 75,000 doses of unused J&J vaccine that expire in August, and 26,000 unused Pfizer doses set to expire at the end of the month.
What do you think is still fueling the hesitancy?
There has been an anti-vaccine movement, and it's actually quite strong here in Oklahoma, unfortunately.
But some aren't holding back.
There's no reason to be skeptical. I felt like it was my due diligence to go ahead and get vaccinated.
We do need to race against the risk of a resurgence. We need to get that number as high as we can before the fall so we don't have a reemergence of COVID.
State health officials are pushing for younger adults to be vaccinated by the fall, before classes start up again, like here at the University of Oklahoma, and before the start of college football season, where many stadiums will be back to full capacity. Lana?
Full capacity. All right, Omar, thank you. Dr. Ebony Jade Hilton joins me now. She is the co-founder and medical director of Goodstock Consulting and a professor of anesthesiology and critical care medicine at the University of Virginia. Dr. Hilton, as we just saw, vaccine supply isn't the problem here in the U.S. It's the demand. So what can be done about this persistent vaccine hesitancy?
Right. I think one of the things that has to be done is we have to start talking to people at their heart. And what do I mean by that? We have to make it personal. What we know is that we have this growing population of younger and younger persons that we are seeing inside of our hospital. And unfortunately, with that, we mean including children, that we're seeing these bouts of where the kids were initially, we thought, kind of protected. But with these mutant variants, we're seeing the Delta variant, for instance, it's more contagious and unfortunately it's more deadly, and it's able to actually evade our immune system, even for those who are vaccinated. It's decreasing the efficacy of our vaccine. And so the longer we stay with not getting control of this virus and staying ahead of how it's able to outsmart us, the more we're all at risk of having a pandemic within a pandemic.
The CDC is going to be holding an emergency meeting next week to discuss more than 200 reports of heart inflammation following vaccination. Booster shots are also now on the agenda. What are the questions that need to be answered during this meeting?
Right. I think the system has shown us that it's working, right? We have 200 cases of myocarditis. And what I need the American public to know is that myocarditis, inflammation of the heart, is not a phenomenon that's isolated to vaccines. We know that typically out of every 100,000 people a year, about 10 of us will develop myocarditis. And that's just the heart saying, hey, I've caught a virus, or I've caught some type of process that's caused me to have this inflammatory process. But with the vaccines, what we're seeing is that with these young men in particular, about 85% of those cases are mild cases. They are not having to be hospitalized, that we can treat these with anti-inflammatory medications, and the child does just fine. Other conditions that cause myocarditis, COVID-19. And I promise the consequences of COVID-19 are much greater than that of the COVID vaccine.
Dr. Hilton, as we're discussing the world the implications of the worldwide pandemic on the health and safety of not just others, but also on citizens here in the United States. I want to ask you, because many African nations may not meet the World Health Organization's goal of vaccinating 10% of their population by September. The continent has only, in fact, vaccinated 2% of people so far. What are some of the major obstacles that these countries are facing, and what kind of help do they need?
All right. What we have to start thinking in this pandemic is, yes, we have to think locally. What's happening on your street level is important to you and your family. But what happens in India? What happens in South Africa? It matters to us because the virus does not care about nationality. It does not care about your demographic or who you voted for. It literally just wants to be passed from person to person so it can allow it to mutate, so it can survive to its next generation. And so when we're looking at countries and within Africa that we have low uptake or low availability of vaccines, we have to start being creative. We need the Johnson & Johnson vaccine. It doesn't have to have the cold storage distribution. We need to start thinking of, if we have to get Pfizer and Moderna to those persons, how do we do that in the most efficient, the most effective way to reach the outskirts of those countries? It really is vital to not only our health, overall health of the globe, but also our financial stability as a global entity, because we truly do rely on each other.
Dr. Hilton, I want to shift gears a little bit and ask you about another disturbing statistic that we've seen. And it doesn't necessarily have to do with COVID-19, but may in fact be related to the pandemic. A new CDC report found that a more than 50% spike in emergency room visits for attempted suicide among adolescent girls during the first few months of 2021. Now, that's compared to numbers seen 2 years ago. How concerned are you about this? Do you think that it is in some way related to the stress that we're all experiencing living through this global pandemic, and what more needs to be done?
All right. That's a tremendous effort needs to be made. I have a coworker, Dr. Leanne Webb, and we wrote a children's book early in the pandemic called We're Going to Be Okay. And the reasons why is we wanted to talk to children about COVID-19 and how these mitigation factors of limiting their social abilities, how does it impact how they feel? And at the end of that book, we literally put a journal page where they can write down if they're feeling happy, sad, or indifferent, so that parents can engage in these conversations. It's not only just the impact of the socialization and the isolation they went through, but also we have 40,000 new orphans that are now in the United States of America. We know that parents lost jobs, and what does that financial stress do inside of the home? We know we had a decrease in over 250,000 cases of child abuse not being reported because children were not in schools where they can have these persons looking in on them. So how does that all play into the fact that we did see a 50% increase in our teenage girls? These are things that America really has to grapple with, of how do we, if we go into another phase of where we have a rise in our cases and have to shut back down, how do we make sure we're tapping in and tuning in to what our children most need? And that's emotional and physical support.
Appreciate you sharing your insight, and thank you again for all that you do. Dr. Ebony Jade Hilton, appreciate it.